In this video, we're going to take a look at various definitions of doses for different drugs. And then we're also going to talk about how do we know how much to give a patient. So looking at drug doses, there's a couple things we want to consider. First off, the therapeutic effects. So we want a desirable and beneficial effect because that's going to help alleviate symptoms or treat a particular disease. But we do also have to consider side effects. So those are unintended secondary effects of the drug. They're usually pretty undesirable. Sometimes they can even be toxic if they are harmful to the body. So knowing the dosage of the drug is really important, and it's important to optimize this because if we give too little, then it might not be very effective. But if we give too much, it can be toxic. So getting that dosage right is really, really important. So there are a few different measurements that are used in medicinal chemistry when we talk about different dosages. The first is the LD50, LD standing for lethal dose. And 50 means that basically this is defined as the dose of drug required to kill 50% of the lab animals that are tested. Now that's pretty horrible. We are killing animals here in order to determine what the LD50 is. But this is a really good measure of the drug's toxicity. Basically, it's expressed in units of mass per kilogram of body weight. So, for example, if you had an LD50 of 500 milligrams per kilogram, it means that if you had 100 mice and you gave them a dose of 500 milligrams per kilogram of the body weight of those mice, then 50 of them would die. Pretty horrible, right? But it is really, really important to get this information because it does then give us some information about where we want to start with our clinical trials with humans. So in humans, basically, we have a slightly different measurement. It's called the TD50 or the toxic dose 50. It's a different measure of the drug's toxicity. So again, it's still measuring the toxicity, but this is defined as the dose required to produce a toxic effect, which is an unacceptable adverse effect in 50% of the test population, which in this case is humans. It's really unethical to determine an LD50 for humans because we wouldn't want to kill off 50% of our human population. But it is more ethical to give 50% of our test population an undesirable side effect or an adverse effect versus giving them a lethal effect. So this is measured early on in clinical studies and kind of figured out what that toxic dose is for humans. Finally, the other measurement we have is the effective dose, or ED50. This is defined as the minimum dose required to produce a therapeutic effect in 50% of the test population. Now, because this is beneficial, it's determined for both lab animals and humans. So if you have lab animals, you're doing an LD50 and an ED50. If you have a human population, you're doing a TD50 and an ED50. So it depends on which populations you are testing. If you have these measurements, you can then calculate a therapeutic index. And so the therapeutic index is either the LD50 or the TD50 divided by that ED50. So in animals, you'd use the LD, and then in humans, you'd use the TD. And basically, this index tells you if it's a bigger number, the greater the therapeutic index, the safer the drug. So if you had 100, it means that essentially you'd have to give 100 for every one sort of unit of effective dose. So that means that if you're giving just 1 gram here, then it would take 100 grams to kill 50% of the population. So that's a really, really big number versus 2/1. If you're giving 1 gram, then it means 2 grams could kill half the population. So that's a really kind of close margin here, whereas this is a much, much bigger window. So it's a lot safer. There's also something called the therapeutic window. And so this is the range of dosage between the minimum required to cause a therapeutic effect and the level that produces those unacceptable toxic effects. So when we give a patient a drug, essentially what happens is this curve here. The concentration of the drug will go up, and we want it to be within this therapeutic dosage window here, and then goes back down over time because it basically gets metabolized by the body. Usually the liver is taking care of that. And so when this starts to come back down is when you want a time to give a second dose. So it goes back up and comes back down again. And you really want to keep your patient within this therapeutic window. So you'll see the dosages going up and down here. So each one of those would be a time frame, and you could figure out what the timing intervals are to keep a patient within that therapeutic window. Finally, the last thing we need to talk about is tolerance. So this can occur when the body becomes less responsive to the effects of a drug. And so you need more and more or larger and larger doses in order to produce the same effect. So as that happens, a patient's going to become higher risk of those toxic side effects. This happens a lot with pain medications. And so, you'll start to take pain medications and you won't need much of a dose in order to produce that therapeutic effect, but then you can require more and more and more. And a lot of those medications also have addictive or dependent kind of properties. And so that can cause addiction, especially for those pain medications. So we've taken a look at different dosages of drugs, various ways to measure it, how we keep patients within a therapeutic window, and what happens when we become tolerant to a drug. That's it then for this video. We'll see you in the next one.